Welcome to this second unit of Module 5, in which we are studying the possibilities of narrative medicine in spiritual care. If in the first unit we reviewed the theoretical foundations of narrative-based medicine, we will gradually advance in our basic knowledge and in the possibilities that narrative offers us in the relation to spirituality from the point of view of health. To do so, we are going to use different perspectives. The first one is the perspective of health professionals. Spirituality, as a universal phenomenon, has multiple definitions. Most scholars point out how each human being experiences it differently according to their own experience and belief. Despite the complexity of defining it, there is a consensus in the scientific community about its importance in caring for and coping with illness. In the particular case of nursing, for example, which is the science of care per excellence, this idea is particularly important. Florence Nightingale, one of the leading nursing theorists, already contemplated the importance of spirituality in care. For her, spirituality is intrinsic to human nature and is the deepest and most potent healing resource for the person. Virginia Henderson, another important nurse, included spirituality within her basic needs, speaking of it as the patient's needs to practice his or her belief, understood as the person's capacity to explore, know, and promote his or her own principles, values, and beliefs. Marjorie Gordon, another of the great theories of nursing, defines in her pattern number 11 what she calls values and belief. For the historical nurse, this includes spiritual, art, or religious values, goals, and beliefs, which influence or guide the individual's life choices and decision making. Spirituality in the nursing profession, we might summarize, implies consent to the patient in their need for physical care or information and the recognition as a person. Neiden and Erickson in their studies refer to this as the blending of the art of the nursing profession with human science. In a classic work on the professional and ethical implications of spirituality in nursing care, writes, 1998, state that within the concept of holistic nursing care, spirituality is seen as interdependent and interrelated with the physical and social components of all other human dimensions and is therefore central to the delivery of holistic care. Furthermore, assessing and responding to the patient's spiritual question and needs is an expression of holistic nursing and is validated by professional organizations such as the American Holistic Nursing Association, the International Council of Nurses, and the American Association for Nursing Diagnosis. It is not only spirituality important for nurses and their nursing science. Several studies have shown an important involvement of the spiritual dimension in coping with illness from any approach, and positive correlation have been found between recovery rates and spirituality. Also, in the case of physicians, the literature reflects a high interest of patients to discuss spirituality in the medical consultation, but a low frequency of physicians raising the issue. We can see, therefore, that historically spirituality has been given a very important place in care and coping with illness. However, despite this importance, spiritual needs are completely neglected and there is no clear model for action. It is paradoxical to review, for example, how the clinical history does not at any time contemplate this need in the same way as other resources. In the specific case of nursing, it is essential that nursing students and professionals reflect on this fact. We need to know the reasons why this situation occurs as a basis for improving our work. In this first video lesson, and through the readings offered in this module, we will delve deeper into this issue, investigating the reason that the scientific literature highlights for not providing spiritual care in clinical practice as we should. A recent review, for example, has shown that the most important barriers to discussing spirituality and religion are lack of knowledge and or training, lack of time, and personal discomfort. Other studies have indicated that the three main barriers are the perception that spirituality is not part of the professional role, that it is an inappropriate health activity, and as above, lack of training. Building on these studies, recent research has sought to better understand the challenges inherent in the spiritual debate and to explore more deeply the reasons underlying the reluctance to embrace spirituality within healthcare. In level 2 of this unit, you can find one paper on this subject. A prominent thing was the confusion between religiosity and spirituality, as the rejection of the former sometimes leads to an inadvertent rejection of the latter. Organized religions, as well as other authoritative institutions, are often viewed with suspicion. The historical separation between spirituality and science makes the discussion of spirituality in healthcare unexpected and often rejected. Other studies along the same lines have pointed out that barriers to including spiritual care in daily practice occur at three levels: individual, professional, and organizational. Fear of imposing their belief on others, fear of personal spiritual vulnerability, and again, limited training in the field of spirituality, including spiritual assessment, are very important elements. Interestingly, these studies continue to mention how organization also creates barriers that impede nurses' ability to provide spiritual nursing care. Just educational organization also creates barriers to providing spiritual nursing care. The study can also be found at level 2. As a result of the above, there are many and varied reasons why health professionals may be reluctant to explicitly embrace, identify, and integrate spirituality into nursing care practice. Some strategies for addressing these barriers and increasing the visibility of spirituality are presented in more detail in the accompanying text. For example, training always appears in all research, a fact that we partly try to alleviate with courses such as this one. In addition, there is a need to provide necessary communication skills to healthcare workers. There is a need to address the underlying confusion about the difference between religion and spirituality. And there is also a need to address the current suspicion with which religion is viewed in clinical practice. To learn more about the causes and possible solutions, I encourage you to review the proposed bibliography to read another recommended bibliography. This video is only a general introduction, so it is advisable to go deeper into the available tools. In the next videos, we will go deeper into some of these possible tools and other issues.